Lyrebird has completely changed the way I interact with my patients, and in so many positive ways. Any general practitioner would know that the key to a consultation going well is to be able to attend to your patients, give them full attention. Well, Lyrebird has really allowed me to do this, and it's one of the biggest game changers for me. I'm just no longer staring at the keyboard trying to remember what my patient has just said or what I should be recording. Instead, I can listen, talk occasionally, and focus on the patient. Then at the end of the session, I just press a button and a comprehensive set of notes is generated. I completely love it. Prior to using Lyrebird, the problem with my patient note-taking was it just often wasn't detailed enough. I'm not a great typist, so sometimes I had inadequate content and my notes were just way too brief. My partners now tell me that my notes are so much better because I've got all the detail Lyrebird was recording on my behalf. This is also saving valuable time with every patient because with my hopeless two-finger typing, it was taking me 2 or 3 minutes extra for every patient. Now I don't have to do that either. Lyrebird is saving me multiple minutes for every consult, which really adds up across the week, month, and year. For the past 25 years, I've also worked giving my expert opinion for medico-legal cases. The most common problem I've found when trying to defend a doctor is poor quality notes. Now with Lyrebird, my notes contain way more detail, providing a true record of what was considered during the consultation. It's the best medico-legal protection I could have, and all of it effortless. One of the things I've been most impressed with is Lyrebird's accuracy to correctly transcribe. It can pick up different accents, people who mumble, those who are softly spoken, even if someone's got a stutter. I had a patient with a brain tumour, which meant her speech was incredibly impaired. I was struggling to understand what she was saying, but Lyrebird picked it all up and very accurately. It also filters out all the irrelevant information, like briefly discussing the footy results. I think this is absolutely incredible. Having said that, I will always read over Lyrebird's version of the notes and edit where necessary. A recent example of a change I made was a 5-year-old who described her tummy pain as ouchie. It was recorded as algae, which I thought was pretty cute. When using Lyrebird, it's a requirement to seek patients' approval beforehand. I found that more than 95% of my patients have been happy to have it running during our consultation. Our clinic provides patients with a privacy and confidentiality information sheet that's provided by Lyrebird, and they love it because it outlines how their information remains secure. Many patients actually express an interest in how Lyrebird works, so quite often I demonstrate it at the end of the session. I'll click the Stop Recording button to show them how the notes are transcribed. I then show that once the notes are generated, I simply click Copy, and the only place that record now exists is in their physical medical record, where I would normally be typing the notes anyway. The recording is then eliminated by the software when the consultation is finished. I click New Patient, and the notes are all gone, and it's a blank page again. Patients find this immensely reassuring, and once they see how effective it is, all the doubts are wiped away immediately. By default, none of the information is stored after a consult, and if I do click Save, a de-identified transcript is stored fully encrypted in Lyrebird Health's Australian database for a default period of 7 days. In terms of people feeling apprehensive or concerned about any risks, well, I'd say there were more risks involved with the inadequate note-keeping, which is what I had prior to using Lyrebird. So, in summary, Lyrebird has been such a positive improvement to our medical group, allowing us to have our own intelligent assistant to automate our clinical note-taking, letter generation and care plans, allowing us more time with patients and less time completing administrative duties, which is brilliant.